Well, it's lovely to have the opportunity to be here this morning. We've got half an hour to talk you through a couple of areas of youth health. So we're going to start really briefly with a session around kind of just some tips for improving engagement and driving you, I guess, towards some of the tools that are available for you on the health pathway. And then in the second part of this, my colleague Louise is going to talk about transgender care and providing care for gender diverse young people, children and young people. So just thinking, I guess when we first start thinking about young people, the first point we really want to make is that actually working with young people is a real opportunity and a privilege. And I think if we frame up our work with young people, thinking about this opportunity, thinking about this privilege, will be much more successful in our work with them. Having said that, just going through, so this is data from the Youth 19 survey, which is a survey of young people in high schools from Waikato North, a random sample. And we can see that about a quarter of young people self-report a chronic health condition, about 10% a disability. And this was new information from the Youth 19 survey. Just under a quarter of young people report a chronic pain, long-term pain condition. This will be no news to any of you in primary care. We've seen a huge rise in poor mental health and mental distress amongst young people, which has gone up over the 4 waves of the survey. Bearing in mind this 2019 wave of survey was prior to COVID, so I'm sure a lot of you in primary care are experiencing that things appear to be even more distressing for young people since that time. Some groups of young people seem to have experienced even greater levels of distress, and so this is the data for rainbow young people, and Louise will talk a little bit more around some of the opportunities to support young people in this area. And sexual health trends, we've seen that there's been quite a dramatic reduction in young people who are actually sexually active, bearing in mind this is young people in mainstream high schools. But alongside that, we've seen a reduction in preventative actions against sexually transmitted infections, and also a reduction in young people using contraception regularly. So thinking a little bit about where young people go for their healthcare, I guess most young people over a 12-month period will see a health provider. So young people do access care. And when we think about where young people identify the usual place for their care, it is predominantly primary care. So people working in primary care are the people that provide most of the health care for young people. Having said that, when the young people were asked who they had used in the last 12 months, I just wanted to highlight the place of clinics and schools. So the Ministry of Health has been funding school-based health services since about 2008. There's been a growth in this area. Now it's decile 1 to 5 high schools, alternative education and teen parent units. And 1 in 5 young people will use a school health clinic over the preceding 12 months. These are, some of you in the audience probably work in school-based clinics. They're highly trained registered nurses. A number of them have a GP or a nurse practitioner supporting. And I guess the point in bringing this up is really to think about these, this is part of your care team. So think about the opportunities with the health providers that are sitting in schools. I've got there, I could find the link in counties and Waitemata for the list and contacts of the school-based services. It was a little harder to find the ones in Auckland Central, and that list there is actually taken from 2017, so there are some additional schools on there. In counties, the support for school services comes through the DHB. In Waitemata, it comes through the Youth Health Hub, which is a primary-based youth service. And in Auckland Central, the support comes through ProCare with the enhanced school-based services. So of concern, when we think about this, as young people also asked how many times people had needed to see a health provider and hadn't been able to see one when they wanted. And again, about 1 in 5 young people report wanting to see a health provider and being unable to see one. And as we might expect, that was higher for people in areas of high deprivation, and also, despite all the efforts that have been put into school-based services, actually higher for young people in low decile schools. This is not getting better over time, so this is from the 2007 survey to 2019. We have not really made a lot of improvement in terms of young people being unable to having episodes where they've wanted to see a health provider and haven't been able to. So this was from an analysis we did in of the 2007 data, looking at that stage 17% of students had not received care when they'd wanted. And if you look down the bottom there, concerns around privacy affected about 30% of young people and were the reason why they didn't access care when they wanted to. And so I guess that's one of the second big points to make this morning, is it's worthwhile to invest time and energy in assuring young people of confidentiality and providing opportunities for private access to healthcare. So we know that concerns about privacy result in more foregone care, particularly for areas that are more sensitive. And we also know that young people with chronic health conditions actually reported the most foregone care, and that was particularly around areas where there was risk behaviour and poor mental health. This is from 2019. This has not improved over time, so young people's report of being able to see providers in private or with confidentiality has not improved over the 4 waves of the survey. So really the key messages are we need to see young people ideally with a caregiver and alone, which I know can be difficult in your 7 or 15-minute primary care appointments. A new area to consider around this is virtual consults, and so really thinking about who's in the room when somebody's doing a virtual consult, checking in who else is around that screen. If you believe you're talking to a young person privately, who else might be in the room and might be listening in, and that's something new that we haven't had to consider before the uptake of virtual consults. And also, as our colleagues from Child Protection were talking before, really explain confidentiality and make sure that young people understand that actually, if there are concerns around confidentiality, you're going to need to talk to somebody about that, you're going to need to bring in support, but that you'll do it with them, you'll bring them along for that journey. And just put on the bottom there, the New South Wales government have done a really nice, it's very short, I know everyone's time poor, but they've got, if you follow that link there, there's some really nice short videos of primary care clinicians in New South Wales explaining confidentiality with the young person and whānau and separating them out. So I'd encourage you to have a look at that if you would be interested. In terms of privacy of information, I guess the most important thing is that parents of young people under the age of 16 have the right to access their information unless that disclosure is against the young person's wishes or their interests. So it's also really important to talk to young people about what you're going to do with the information that you have from the consultation. And one of the points that's coming up increasingly is the use of patient portals. So we really want to be quite deliberate when we're thinking about patient portals and the information that's going on a patient portal and who's going to have access to that. So for many young people, their parents will still have access to their patient portal for quite some time, and they will therefore be able to see all the information that's in there. So we encourage people, there's a document on the GP College website around patient portals and kind of managing those with a section on children and young people that encourages discussion from the age of 12 about who's going to have access to that portal and how you're going to keep that information while respecting everybody's rights. Having said all of that, obviously, parents and caregivers are really important parts of young people's life and young people's care. So we're certainly not encouraging exclusion of young people's whānau. That's a really central part of care, but it's a little bit about giving the young person some control and providing an opportunity where they can access the appropriate healthcare. And that last point about, the time to raise this is not when things are going off the rails. The time to raise this is early so that people have time to get ready and to adjust. So how do we improve access to care for young people? I wanted to bring up the College of GPs endorsed audit, which is for youth-friendly care. This is actually one of the system level measures for youth-friendly practice, and so the goal is that a practitioner, and it will be a GP at each practice, will have done this youth-friendly audit. The information on the audit is on the health pathway under youth health, and I'll show you that in just 1 minute. And there are a number of resources on the health pathway to help people work through that audit and get their college points, as well as that link there for Counties Manukau. We've got a range of resources on the website and some of the Goodfellow unit resources, which I've got in another slide. So this is what you'll see on the health pathways for youth health, and I really encourage people to have a look at this. A number of the PHOs have a youth assessment for 16-year-olds, which is on your dashboard. Again, become familiar with that and utilise that. Sexual health in youth, there are a number of funded initiatives, including access to long-acting reversible contraceptives, which is slightly different in all the DHBs. But I really encourage you to become familiar with that and have a look around. In terms of mental health, there's a huge amount of resource on health pathways, including patient resources, so information on apps and places that people can go, and just to signpost people that there is primary mental health access funded in all the Metro Auckland DHBs through Your Choice in Waitemata, Fresh Minds in Auckland, and the Wellness Program in Counties Manukau, and really encourage, those are available for young people as well. If you're working with a young person who's in a school, remember the school guidance counsellor, remember the school health team can be part of your package of care also. Just for further resources, remember on the Goodfellow unit there's a range of different resources that people can access in terms of working with young people. Also the New South Wales video vignettes, which really are fantastic if you're short on time and just want a little look. Always encouraging people to come and join us at Auckland University doing some postgrad study in clinical youth health. And our service in Counties Manukau runs some training as well for people that are interested. So just some key messages really. Young people do have health issues. Primary care is where they identify their main port of call for access to healthcare. Think about the resources that are around you. You don't have to do everything. Think about those resources in schools. Always take the time to invest in talking about privacy and confidentiality with young people. It will make your job so much easier. Complete that youth-friendly audit. It'll help you get your MOPS points, and it will also help improve the quality of care. Use the resources on health pathways and utilise those funded programs around sexual health, mental health and the youth assessment. So I'm going to hand over to Louise, who's going to talk through now some of the work that our team's been doing around gender-affirming healthcare.